Imagine a river flowing steadily through a channel. Now picture that river's current becoming too strong, pushing forcefully against its banks. This is similar to what happens inside your body with high blood pressure. Your blood, which carries life-giving oxygen and nutrients, travels through a network of tubes called arteries. Blood pressure is the measurement of the force of that blood pushing against the walls of these arteries. When this force is consistently too high, doctors call the condition hypertension. It is a common health issue, but its commonness does not make it any less serious. A normal reading is typically below 120/80 millimeters of mercury. A high reading is often defined as 130/80 millimeters of mercury or higher. While high blood pressure might not make you feel sick on a day-to-day basis, its long-term effects on the body are profound and can be devastating. Think of it as a slow, steady erosion of your internal systems. The constant high pressure damages and hardens your arteries, atherosclerosis. That makes arteries narrower and less flexible, forcing your heart to pump harder to circulate blood. The vicious cycle puts immense strain on the heart muscle, causing it to thicken and weaken over time. Eventually, this can lead to heart failure, when the heart can't pump enough blood. The damage isn't limited to the heart. Your brain is also highly vulnerable to uncontrolled hypertension. Narrowed or blocked arteries may cause an ischemic stroke, depriving part of the brain of oxygen. Understanding what causes high blood pressure is the first step toward preventing it. The risk factors can be broadly divided into two categories. Those you cannot change. Those you can. Among the factors beyond our control are age, genetics. As we get older, our blood vessels naturally tend to become stiffer, which can contribute to a rise in blood pressure. Similarly, family history plays a significant role. If your parents or other close blood relatives have had high blood pressure, your genetic predisposition makes you more likely to develop it as well. While you cannot change your age or your genes, one of the most effective tools you have to manage and prevent high blood pressure is the food you choose to eat every day. Your diet can either contribute to the problem or be a central part of the solution. A cornerstone of a heart-healthy diet is reducing your sodium intake. Most of the sodium we consume does not come from the salt shaker on the table, but rather from processed, prepackaged, and restaurant foods. Frozen dinners, canned soups, deli meats, chips, fast food. Start by reading the nutrition labels on packaged foods and choosing low-sodium or no-salt-added versions whenever possible. Cooking more meals at home gives you complete control over the ingredients and allows you to season your food with herbs, spices, garlic, citrus, instead of salt. Increasing your intake of fruits and vegetables is another critical step. These foods are naturally low in sodium and high in important nutrients that help lower blood pressure, particularly potassium. Potassium works in your body to counteract the effects of sodium, helping to relax blood vessel walls and excrete excess sodium through urine. Choose whole grains and lean proteins, and consider the DASH eating plan, dietary approaches to stop hypertension. Alongside a healthy diet, regular physical activity is a non-negotiable component of any plan to prevent or manage high blood pressure. When you are physically active, you strengthen the heart. A stronger heart can pump more blood with less effort. If your heart can work less to pump, the force on your arteries decreases, which in turn lowers your blood pressure. The goal recommended by most health organizations is at least 150 minutes of moderate intensity aerobic activity per week. Break it down: 30 minutes a day, 5 days a week, or 3 10-minute walks across the day. Brisk walking is a perfect example. You do not need any special equipment, just a comfortable pair of shoes. Cycling, swimming, water aerobics, dancing, vigorous gardening, or yard work. Find activities you genuinely enjoy. That makes you far more likely to stick with them. Add strength training at least 2 days a week. Strength training builds lean muscle mass. More muscle burns more calories all day, which helps weight management and blood pressure control. While diet and exercise are the foundational pillars of blood pressure management, other daily habits and lifestyle choices play an equally critical role. One of the most impactful changes you can make is to achieve and maintain a healthy weight. As mentioned earlier, being overweight or obese significantly increases the workload on your heart. The good news, even modest loss lowers blood pressure. Losing as little as 10 pounds, about 4.5 kilograms, can make a real difference. Limiting your alcohol intake is another crucial adjustment. Excessive and regular alcohol consumption can steadily raise your blood pressure over time. The general recommendation is no more than 2 standard drinks per day for men and 1 for women. A standard drink is 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80-proof spirits. If you do not currently drink, there is no health reason to start. If you do, cutting back can help your numbers. Quitting smoking and all forms of tobacco use is absolutely essential for cardiovascular health. Nicotine spikes BP immediately, and chemicals damage artery linings, accelerating atherosclerosis. Quitting is one of the best things you can do, and support is available. Manage stress and prioritize sleep. Aim for 7 to 9 hours. Make your room dark, quiet, and cool. One of the most empowering actions you can take is to monitor it yourself at home. While checkups at the doctor's office are important, they only provide a snapshot at a single moment in time. Anxiety can elevate readings, white coat hypertension. Conversely, some have normal clinic readings but higher elsewhere, masked hypertension. Regular home monitoring shows a more accurate picture across your daily life. Away from clinical stress. Use a validated upper arm monitor with the correct cuff size. Ask your pharmacist or doctor to show you. Rest a few minutes first. Sit upright, feet flat, arm at heart level. Measure at consistent times daily, 2 or 3 readings, 1 minute apart, morning before meds, and evening. Translating all this advice into action can feel overwhelming, but building a heart-healthy routine is best done one small, consistent step at a time. Creating a simple daily blueprint can help make these changes feel automatic and manageable. Start your day with a moment of intention. Before you even get out of bed, take a few slow, deep breaths to center yourself. If you are monitoring your blood pressure at home, this is the ideal time to do it, after resting quietly for a few minutes. For breakfast, skip the sugary cereals and pastries. Try a bowl of oatmeal topped with berries and nuts, or a serving of low-fat Greek yogurt with a piece of fruit. During your workday, set a timer to stretch every hour. If possible, take a brisk 10 to 15-minute walk during your lunch break. Pack a healthy lunch to avoid high-sodium takeout. Keep healthy snacks on hand to fend off cravings. In the evening, make cooking dinner a relaxing ritual. Use herbs and spices instead of salt. After dinner, choose an activity that helps you de-stress. Disconnect from screens before bed. Create a calming routine and keep a consistent sleep schedule. Preventing and managing high blood pressure is not about achieving perfection overnight. It is a journey of making conscious, positive choices day after day. It is about recognizing that you have a tremendous amount of power over your own health. Eating nourishing food, moving your body, managing stress, sleeping well, avoiding tobacco, avoiding excess alcohol. They are acts of self-care and investments in your future. Each healthy meal you eat, each walk you take, and each good night's sleep you get is a step toward a stronger, more resilient cardiovascular system and a longer, more vibrant life. Be patient and kind to yourself. The goal is not to be flawless, but to be consistent. Focus on progress, not perfection. Know when to seek medical help. If lifestyle changes aren't enough, your doctor may recommend medication. It's a tool to protect your organs. A reading of 180 over 120 millimeters of mercury or higher with severe symptoms is an emergency. You hold the key to a healthier future. The knowledge is available and the tools are within your reach. Start today. Don't wait for a health scare. Make one small change.